Hello, in this video I am going to talk about diabetes mellitus. When this disease is mentioned, two words usually come to mind, sugar and insulin. That's why I wanted to start this presentation by briefly talking about them so we can better understand the disease. Sugar is a type of carbohydrate which is one of the three main macronutrients in our diet. Macronutrients are nutrients that the body needs in large amounts to provide energy, support growth, and maintain normal bodily functions. The three macronutrients are carbohydrates, proteins, and fats. Carbohydrates and proteins each provide about 4 kilocalories per gram, while fats provides about 9 kilocalories per gram. Together, they supply the energy required for metabolism and essential physiological processes. Although sugar is often viewed negatively, it is important to remember that it is still a form of carbohydrate and therefore a macronutrient with a biological role in energy production. Like all nutrients, it should be understood in balance as part of varied and healthy diet. So in this slide, I'm talking about carbohydrates, which are the main source of energy in our body. They are divided into three main types. First, monosaccharides. These are the simplest form of carbohydrates made of a single sugar molecules. Examples include glucose, fructose, and galactose. Among them, glucose is the most important since it's the main sugar circulating in the blood. Next, we have disaccharide. These consist of two sugar molecules linked together, such as saccharose, lactose, and maltose. Before the body can use them, they need to be broken down into simpler forms. Finally, we have polysaccharides. These are more complex structures made of many sugar units like starch, glycogen, and cellulose. They are digested more slowly, providing a more sustained source of energy. What's interesting here is that glucose is so essential that even if we don't get enough of it from food, the body can produce it from other sources. In general, sugar is a vital source of energy, especially from carbohydrate-rich foods like bread and rice. However, when consumed in excess, it can have harmful effects on the body. That's why managing sugar intake is important, not just for weight, but also for maintaining stable energy levels and overall health, especially in conditions like diabetes. After eating, blood glucose level rise naturally. In healthy people, this increase is controlled and returns to normal levels. However, in people with diabetes, blood glucose levels remain high for a long time, and this chronic high level of glucose in the blood is what defines diabetes and leads to serious complications over time. What is insulin and what does it do in the body and why should you care about it? Insulin is a hormone produced naturally by the beta cells in the pancreas. Its main function is to help glucose enter the body's cells where it is used for energy. You can think of insulin as a key that allows glucose to enter the cells. Without enough insulin, or if the body does not respond to it properly, glucose cannot enter the cells. As a result, glucose builds up in the bloodstream, leading to high blood sugar levels and the development of diabetes. Diabetes is a chronic metabolic disease that occurs when the pancreas does not produce enough insulin, or when the body is unable to effectively use the insulin it produces. The symptoms of diabetes depend on how high blood sugar levels are. Some individuals, particularly those with the pre-diabetes, gestational diabetes, or type 2 diabetes, may not experience any noticeable symptoms. Some common symptoms of both type 1 and type 2 diabetes include increased thirst, frequent urination, unexplained weight loss, fatigue and weakness, irritability and other mood changes, blurred vision, and slow healing wounds. So when should you see an endocrinologist? If any signs or symptoms of diabetes are present, it is important to consult an endocrinologist. Early detection allows for timely diagnosis and treatment. For individuals already diagnosed with diabetes, regular follow-up care is essential to effectively monitor and manage blood glucose levels. Diabetes is classified conventionally into several clinical categories. We have type 1, type 2, specific types of diabetes, and gestational diabetes. So let's start with the first one, which is type 1 diabetes. Here, this slide explains what happens in type 1 diabetes. First of all, let me give a definition to this type of diabetes, which is an autoimmune condition that someone is born with. That's why I wrote here autoimmune destruction of beta cells. So in the left side, we can see the normal situation. Insulin is produced by the pancreas and it helps glucose enter the cells where it's used for energy. You can think of insulin, as I said before, that it's like a key that opens the door, allowing glucose to move from the blood into the cell. And on the right side, we see what happens in type 1 diabetes. In this case, the pancreas does not produce insulin at all. So even though glucose is present in the blood, it cannot enter the cells. As a result, the glucose builds up in the bloodstream while the cells are actually lacking energy. That's why people with type 1 diabetes need insulin therapy, because their body cannot produce it naturally, and it's insulin required for life, for survival for them. So now let's look at what happens in type 2 diabetes. Unlike type 1, the pancreas still produces insulin, sometimes even normal or higher amounts. But the problem here is that the body's cells don't respond properly to insulin. This is what we call insulin resistance. So even though insulin is present, it's not working effectively. It's like the key is there, but the lock is not responding properly. As a result, glucose cannot enter the cells efficiently and it starts to build up in the bloodstream. Over time, the pancreas may get tired and produce less insulin, which makes the condition worse. That's why type 2 diabetes is often linked to lifestyle factors like diet, lack of physical activity, and obesity. And I wrote here most common type because it accounts for 90% of diabetes cases. So about specific types of diabetes, in a small number of cases, diabetes can be caused by a problem in just a single gene. This type is known as monogenic diabetes. Unlike other types here, one gene abnormality alone is enough to cause the disease. Monogenic diabetes includes a few main types, such as, firstly, we have maturity onset diabetes of the young. Second, we have neonatal diabetes, which appears early in life, and third, we have syndromic diabetes, which is associated with other conditions. The human body has around 25,000 genes, and so far, more than 20 of them have been linked to this type of diabetes. So a mutation in just one of these genes can lead to diabetes in either children or adults. And an important point here is that this type can run in families, meaning it can be inherited. And about the gestational diabetes is a condition that develops during pregnancy, in which blood glucose levels become elevated due to reduced effectiveness of insulin. It's not caused by a lack of insulin, as in type 1 diabetes, but rather by insulin resistance. During pregnancy, the placenta produces several hormones, including estrogen, cortisol, and human placental lactogen, which are essential for maintaining the pregnancy. However, these hormones can also have a contra-insulin effect, meaning they interfere with the normal action of insulin. This usually begins around the 20th to 24th week of pregnancy. As the placenta grows, it produces increasing amounts of these hormones, which further increases insulin resistance. Normally, the pancreas compensates by producing more insulin. However, when it cannot produce enough to overcome this resistance, blood glucose levels rise, leading to gestational diabetes. About risk factors, the risk factors for diabetes vary depending on the type. Age, ethnicity, genetic history, lifestyle, obesity, diet, medical condition, and stress and sleep. If you eat healthy, you will stay healthy. Genetics tend to be unfair. While some people seemingly can eat and drink anything they want, others can gain weight almost by looking at food. No one can stop being obese from one day to another, but everyone can do something to control their blood sugar variations. My tips here are simple and can be applied to start immediately. First, stop drink sugary sodas and energy drinks. This takes away lots of empty calories and is the single most effective thing you can do to stabilize your blood sugar. Second, eat a real breakfast every day. Why? Because when you eat a full breakfast, you will snack and eat less during the rest of the day. This helps your blood sugar stay at a healthy level without ups and downs. And third, take away as much as possible of the fast carbs. Burgers, pizza, white bread, and fries make your blood sugar rush up and down like a roller coaster. Use your body, take a walk, try to get a little exercise during the day. Every day, a daily 30-minute walk can do wonders to your weight, your circulation, and to the hormones that regulate blood sugar, appetite, sleep, and loads of other things that make us feel better. I know that changing habits is a hard thing to do, but what could be more motivating than giving yourself the best possible lifestyle? And remember that every little step counts. Try out what works for you, and I am sure you will notice the difference within weeks. And that brings us to the end of today's video. In the next video, we will dive deeper into the complications of diabetes mellitus along with treatment options and the different pharmaceutical forms of insulin. Thank you.